Communities in the U.S. have added fluoride to tap water for decades in an effort to help prevent cavities. Last month, though, Utah became the first state in the U.S. to ban that practice. As Christine Pei with our Seattle sister station reports, now some cities in Washington are also thinking about doing the same.
Let's start with what fluoride is.
Fluoride is a natural element. It is found in rocks and soil and water.
The mineral is also known for its anti cavity properties. It's added in toothpaste to help strengthen tooth enamel. Since the 1940s, communities began adding small concentrations of fluoride into tap water as a public health measure to prevent cavities, especially among children. But recent studies have gained attention, showing certain concentrations of fluoride, when ingested, could cause neurological issues among kids.
The thing I think to keep in mind with these studies is that the data that these studies are based on come from countries where the natural level of fluoride in the water is many, many times higher than what we find in the US.
Dr. Donald Chi is a pediatric dentist and professor of dentistry at the University of Washington. He says the federally accepted concentration of fluoride in the U.S. is low at zero point 0.7 parts per million.
What this level of fluoride does is that it protects our teeth throughout the day. So most of us drink tap water, cook with tap water, and so what it does is it provides that constant protection from cavities that all of us need. Every time we eat something with sugar in it,
When sugar is broken down by the bacteria in our mouth, it can erode tooth enamel.
what the fluoride in drinking water does is it helps to repair those small microcavities that form.
Dr. Chi says the U.S. concentrations are low enough to be safe if ingested, as it will pass right through the body. He says it's important to compare the zero point 0.7 parts per million levels in drinking water to more concentrated levels of 1,000 parts per million in toothpaste, which is applied topically.
It's much more concentrated. It's still safe. This is the reason why I think with any kind of fluoride, whether it's fluoride in your water or the fluoride that we brush our kids' teeth with, the supervision aspect is really important.
In Washington state, water fluoridation is decided at the local level. The city of Seattle, for example, follows the zero point 0.7 parts per million threshold, while far higher concentrations of fluoride in water is something to consider. Chi maintains our levels are safe.
Based on the evidence, we know that zero point 0.7 parts per million is safe. It doesn't lead to, IQ problems or any other kind of health concerns. But we'll continue monitoring that, and I think that that's really important to do.